Tuesday afternoon in the break room with a lukewarm coffee. You are staring at a certified letter that costs $70,000. Phones are quiet, but the front desk manager looks pale. A former patient wanted their records 9 weeks ago, and you never sent them. Now the federal government is involved, and they are not asking nicely. This is not just a fine. It is half your annual profit gone in one signature. Most owners think HIPAA is just keeping files locked away. The mistake is forgetting the patient owns the data, not you. In this video, you'll learn how to fix your request process so one ignored email doesn't sink your business. You catch yourself thinking, why would anyone go after me? It's literally me and my laptop. You've told yourself the cheap solution ended up costing us more. You're stuck in that place where you say, I just want to sleep at night knowing we're protected. I'm Kevin, founder of Century Systems. For over 26 years, we have been helping small businesses like yours avoid costly compliance mistakes. You're usually buried in the day-to-day work of filling cavities and managing your staff. It's like keeping the house running and making sure the front door is shut. When a records request hits your desk, it feels like just another knock at the door, minor administrative noise you don't have time to answer. Federal data shows solo practices are at high risk because they lack a dedicated compliance officer to watch the windows for blind spots. You assume that as long as you've got a deadbolt keeping hackers out, you're safe from the law. But being safe isn't just about keeping the back door barred against intruders. It means data must be accessible when it's legally required. Dr. Carson runs a busy 3-chair dental practice. She manages a tight ship with 2 hygienists and a front office manager who keep the chairs filled and the schedules moving. It's a high-energy environment, and Dr. Carson prides herself on being involved in every part of the operation. But things got complicated when a long-term patient left on bad terms. There was a messy billing dispute that never got resolved, and the patient eventually moved across state lines to start over. A few weeks later, a formal records request from a new dental office pops up in the inbox. It sits there for 30 days while the front office staff handles insurance claims and local appointments. Doctor eventually sees the request, but she still feels the sting of that unpaid bill. She tells her manager to wait until the billing dispute is settled before they release any files. It feels like a reasonable business decision to hold on to the data until the practice gets what it's owed. 50 days pass, and the silence is broken by a formal complaint from the Department of Health and Human Services. Federal investigators show up at the practice, and they aren't just there for a friendly chat. They dig into the logs and find a clear pattern of the office slow-walking patient requests. Because they find evidence of a deliberate delay, the practice is hit with a $70,000 penalty for willful neglect. The financial weight of the fine is a complete shock. Doctor is now forced into a corner where she has to choose between paying the penalty or letting go of her senior hygienist to cover the shortfall. This all happened because the original email was flagged as a low priority item. It wasn't a clinical alert or an emergency, so the system didn't push it to the top of the pile. That's how a small issue turns into a big mess when business disputes get in the way of data rules. This situation shows that compliance is a workflow problem, not just a legal one. When you don't have a clear process for every request, it's easy for personal frustrations to cloud your judgment. Ignoring a request is treated exactly like losing the data, and federal regulators don't care about your billing disputes when they're looking for willful neglect. It's about building a system that removes the guesswork before a fine breaks your business. It was a Friday morning when a dentist I've known for 10 years called my cell phone directly. Usually we talk about golf or family, but I knew the second I answered that something was wrong. He sounded hollow, like he had been up all night, and told me the feds were auditing his entire office. He had already spent a week trying to manage the auditors on his own, trying to find missing documents and make excuses before the urgency of the situation finally broke him. I walked into his private office an hour later, and he had 3 years of logs spread out across a large mahogany desk. It was a sea of paper that he couldn't make sense of. He looked at me, completely defeated, and said, I thought as long as we were not hacked, we were fine. He had spent his whole career worrying about hackers and ignored the rules sitting right in front of him. The financial damage was already staggering, The federal fine was already set at $65,000, but the legal fees he was paying to fight the process were climbing even faster. The most painful part was the timeline revelation. The investigation had actually been in motion for 6 months before he realized he could not just explain it away with a phone call or a promise to do better. I looked at the mess and gave him the only diagnosis that mattered. I told him, the law does not care if you are busy or if the patient was difficult. The regulations don't pause because your office is understaffed or because a request felt unfair. He didn't argue or try to justify it anymore. He just sat there and stared at his hands, realizing he had lost his kid's college tuition over a simple filing cabinet delay. We were able to contain the operational mess eventually. We set up a digital tracking system that flags every records request with a hard countdown so the staff knows exactly when the clock is ticking. It was a hard, exhausting month to get that system restored and running, but it stabilized the practice. However, the damage to his name was permanent. The local paper ran a story about the federal fine and the HIPAA violations, and his new patient numbers dropped by 40% almost overnight. That lost trust is a missed opportunity he will never get back. I see this in dental offices, clinics, and small law firms every single month. The belief that compliance is just a later problem. If you could rethink one thing today, let it be the assumption that a lack of immediate consequences means compliance isn't your responsibility. The real problem here isn't just about following rules. It's about how easily a simple request can fall through the cracks, costing you not just in fines, but in trust. When the safeguards aren't clear and the process isn't owned, it exposes you to serious fallout that can disrupt your entire practice. Based on what we discussed, you should use our cyber health check and see exactly where you're exposed and what to fix first. The link is in the description. In the next video, I'll show you how to create strong passwords that protect your data.